The views and opinions expressed by guests on this show are those of our guests, not necessarily ours. We are interested in presenting different viewpoints and strive to be neutral parties. We leave it up to you to make your own judgments. Welcome to Vision Chat, a podcast about spiritual topics, with your hosts, Virginia and Stine. Welcome back to Vision Chat. Today, we are interviewing Dr. Yessenia Guglielmi. Yessenia is a Mexican-American mental health therapist from New Jersey who works with clients from diverse backgrounds in English and Spanish. She is a mother, writer, professor, and works in higher education at Urban College of Boston. As a writer, she published her first book in 2016 under her pen name Lucina Stone. She continues to publish short stories and is currently working on 2 novels. Her dissertation, titled White Magic, The Intersection and Application of Magical Realism and Transpersonal Psychology, is a sharing of personal and creative stories that explores her journey with intuition, writing, and transpersonal exploration as an experiencer. Wow, Yessenia, it's so wonderful to have you on. Thank you for being here.
Yes, thank you so much for having me on. It's just wonderful to find people to talk about these topics with. And I love that the community is growing and there's more and more people to converse with about these topics.
Awesome. We love it. Would you like to just start us off by telling us a little bit more about yourself and your journey?
Yeah, so I've been in mental health for over 20 plus years now. And I kind of came into the field really not knowing, I had never heard about social work or counseling or even knew that it was like a profession that you could have. So I just kind of fumbled into it. I feel like I was being guided into this kind of work. And as I got into it, it was so revealing to me in terms of all the things that I wanted to learn, all the things that I wanted to explore. So I dove into it, and in my time, I've worked at every single level of care. I just went into the field just very hungry for learning. So I've worked inpatient, outpatient, every setting, schools, universities. I just went and just dove into the work. So it's been really great, and I've gotten to work in populations that most people never do or never have the opportunities to. So that's been really great. Yeah, so it's been a long career. I think around the time when I was kind of going through perimenopause and starting that journey for myself, I had gotten really disheartened with mental health, with the field, with the disadvantages that I was noticing in the work. And so during that time, I just kind of for the first time in my career, really wanted to do anything else. I was really very disengaged from the work, and I was just really struggling with it. And so I had an experience with a family member who helped me with psilocybin and exploring that. And since that experience, I am renewed in a way that I had never thought that I would be.
Do you have any labels for yourself?
I define myself as a sage. So as a sage, more of a healer of the mind, more of a guide, more of a mentor, somebody who helps others on their spiritual journeys, on working through fear. So using that wisdom, that education, that experience to help people along that path.
So I want to give people a little bit of a background of how you came on the show, because I want to go into what you mentioned a little bit before about the perimenopause. Yeah, I found you on the Witchy Therapists Facebook group, and it's such an awesome group because you have all these amazing people from all over the country. And it's a unique blend of therapists, mental health specialists, and people who are interested in witchy things. And I liked that you had put a post out about just having this unique perspective as a therapist with clients, and seeing that there was some kind of a link or something going on with women going through perimenopause and seizures. And I've never seen anything like that before. But also, we've had other guests on the show to talk about perimenopause, and it's just one of these things that, personally speaking, it hit me by surprise. I'd always heard menopause, but I've never heard of perimenopause. And so I didn't know that there was this stage before hitting menopause that women go through, and just the variety of things that come up that really catch us by surprise, or unless you're well versed in this. I wanted to really just pick your brain a little bit about what you're seeing. What is this connection with seizures?
Yeah, so I don't have like a huge practice of like hundreds of patients. So, but in my small practice, I have seen a few cases of women who have had seizures during their kind of earlier time in perimenopause. And it's shocking, it's surprising, it comes out of nowhere. And they're just not listened to, they're just not heard. And it really leaves them terrified because, again, a seizure could hit you at any time, in your sleep, and you just don't know whether you're going to be susceptible to that. So what really drew me to that article was to let women know, like, hey, this could happen. Continue to learn more about your body, continue to learn more about your symptoms, not in fear, but in awareness and in educating yourself and family. I think that it's been great that we have a lot more information and a lot more dialogue about perimenopause, but sometimes it could be very like fear-inducing. And so I really want to talk about perimenopause as a time of great spiritual awakening, great awareness of your body, and such a wonderful time to really connect with yourself in a way that maybe you've never been able to do because you've been mothering and caretaking and working and studying. So it's really like, it's almost like the universe tells you, no, you're going to sit down and you're going to really pay attention to yourself for the first time ever. And I think that can be incredibly empowering.
When did your own spiritual journey start?
I think I've been on it for a while, really going through a very clinical program. Some of my experiences were not really something that, probably keep that to yourself, not really something that was discussed. And there's a lot of pathology. And so you're always looking for pathology. You're kind of honed in on like, okay, well, what's the diagnosis there? What are the symptoms? And so it wasn't really a space when I was going to graduate school that you could really discuss a lot of these other areas. I think I was like the only Latina that graduated in my class, in my graduate program. So, there weren't a lot of conversations about culture. There weren't a lot of conversations about psychic abilities and other experiences that wasn't discussed. It was very clinical.
Going back for a moment to the way that you phrased that time of perimenopause as a spiritual awakening, or like you framed it in such a positive way.
Mm-hmm.
And it's, it's often framed in like negative or, oh my God, this is horrible. And I'll be honest, I feel that way. And I've been struggling also to kind of like feel more positive about it. I'm really curious about this magical piece that you're kind of talking about, and also because it sounds like this is something that you're writing about, that you're studying as well. How do you blend these two worlds together?
I think I blend them through magical realism. It's not magical thinking. It's really magical realism in the terms of like where you're finding wonder in the most ordinary, where you're finding those moments of like joy. I think like some of the most prolific writers of magical realism were living through times of like great turmoil, and being able to find the joy in these really difficult times is a gift. And so I think that that's why it's so important for people to really consider counseling, to consider therapy, because it's a way of reframing things in a way of like, oh, I never thought of that way, and that could really change you. That could really create momentum for you in a way that you'd never experienced before.
Do you feel comfortable going into a little bit of what what brought you to writing that article with the seizures? Like, what inspired you to write it? And is there anything for people listening that they can find your blog if they have questions? What kinds of things can they be on the lookout for? Like you said, not to create fear, but just to create awareness.
Yeah. That there is a lot of treatment, that there is a lot of help, that there is a lot of understanding. There's a lot of kindness that's available to people. You don't have to sit with all your symptoms by yourself. You can really explore them so that you can feel more empowered. So I think that, yes, some women will experience seizures, but they will recover and they will be better and they will go on with their lives. Some women will experience heart palpitations, hip changes, body changes, weight gain, bloating, pain. But you will endure, you will go on. This isn't what's going to end you. This is what's going to transform you. So I think that's important to really help women understand so that, yeah, okay, it does suck sometimes. I get it. I'm dealing with, fibroids myself, and it's not great, but you can endure it and you'll be better and you'll be okay. So you also, I think, need that encouragement, that goes a really long way when you're struggling, to have someone to talk to. So I try to make that available, through my own work, and also to kind of put some blog articles out there so that women don't feel so alone in these situations.
Do you have any tips or advice for the people that knows like, okay, in a few years I'm going to premenopause or menopause themselves? How can they prepare themselves?
Definitely reading. Try not to Google all your symptoms, because your experience is going to be very unique. Your experience is going to be very different than maybe my experience. And so really honor your experience, communicate with your moms, with your aunts, hear other women's stories, and try to focus more on not the gloom and doom, but the survival, the aftermath, when women are feeling better, when they're entering that stage in their life in their 50s and 60s and 70s where they're experiencing a lot of joy. So try to move the mind forward a little bit, especially if you're feeling stuck with like a rough week of symptoms of issues.
There was an article about, or a study too, when people actually are the most happiest and most joyful in their life, and that is actually from 50s to 60s, and then they're like finding the most joy.
Yeah, looking forward to that for sure. Yeah, because that's going to be such a great time in my life where like the kids are finishing college and you're like in a whole different place in your life. Yeah, it's going to be beautiful. So I'm really excited about that.
You mentioned turning towards our mothers and grandmothers and aunts for guidance. I've noticed, I don't know if this is cultural, I don't know if this is specific to certain families, but I feel like I myself have experienced this, and I've talked to other women, that the communication or talking about things like your period, things like menstruation, things like menopause, these things are like not discussed really. And I don't know what it is. And I was speaking to someone recently, actually, who was like, well, like when you go into menopause, and she whispered it, is there something really shameful about it or secretive? And I'm like, why are we whispering? Like, why can't we talk about it? Like, is it bad? Like, is there something shameful going on? What are you encountering, or what are you seeing?
Same. I think it fills me with a lot of gratitude, because we don't have to do that. They came from a generation of such silence and such unknowing, and had to really battle and figure this out on their own. And it's really sad that they had to go through that. But they did that so that we don't have to, and so that my daughters don't have to, and so that we're much better prepared, and we keep learning more and more about women's health. And yeah, so that's so important. I know my own mother, same, like when I talk about my symptoms or what I'm going through, and we talk about hers, and she'd never talked about it. She just lived in silence. She just suffered alone, didn't understand what and why she was making certain decisions at the time in her life, or how, that affected her. Like there was just like, oh, wow, it could have been that. I had no idea, so a lot of gratitude.
Do you have any experiences that you would consider magical in your upbringing, or anything that has led you down this path now where you're writing about magical realism?
Yeah, I've had a lot of stories, a lot of experiences. My mom had a lot of experiences growing up that I witnessed. There was a big earthquake, I think in the 80s, that my mom felt about 3 hours before it happened. So she had a strong awareness of like, okay, this is really going to happen. Kind of putting that together was also very strange. I feel like a lot of interventions in my life, a lot of people that have come into my life that have really brought me a lot of knowledge, a lot of reconnecting me to a spiritual path in different ways. I think I write about on my website how I didn't know about counseling, that was even a career option for me at the time. My guidance counselor told me that I should go into cosmetology and cut hair, because she didn't really see me as a student that could really, be able to achieve in that way. So, I was kind of debating that, like, oh, do I go into cosmetology? Is that I don't know. And my uncle had passed away from AIDS in the late 90s. And when he died, there were all these boxes of his things that my father had brought me, a small box, and had just kind of left it in the garage. And then, yeah, this was your uncle's here. You can look through it. And when I looked through it, it had the first DSM manual, and it had the first like abnormal psychology books, and all these, he was in the Rutgers program for counseling, and he had left me all his books. And I was like, wow. And so it just came to me in that way. This was a box that was going to get thrown out that changed my whole life path. So I'm always like super grateful to him for that, because it changed my whole life.
Wow, that's so incredible. Almost like it was set up that you were going this way, or like the intuition or something. Maybe your uncle on the other side too was like, okay, you need to check out this path.
Yeah, he left me like all the tools I needed to really like dive into it. And I would sit there for hours just reading the books and like amazed, like, wow, this is really something people do. Yeah, because nobody in my family did this. And my mother kept saying, she really did not want me to go into counseling. She's like, no, you're going to go crazy. Listening to all those stories, it's going to make you crazy. Like, you can't do it. And so, so I was the first one.
That's so funny. I had a similar experience with my mom when I told her I was going to go into counseling, because the same thing, you don't grow up going to see a therapist. You don't hear about mental health. You do nowadays, but back in the day, you really didn't. And I think culturally, traditionally, it wasn't a thing. You didn't air your dirty laundry. You kept things at home. But it was kind of the same reaction when I told her I was going to go to grad school for mental health. And she was like, well, don't you want to get married and have kids? Like, when are you going to do that? I'm like, well, Mom, I could do both.
Yeah, no, definitely. I think, that stigma, like, why would you ever do that? Like,
I've read somewhere on your website, which is beautiful, by the way. I love the design. I love the colors. It's such a lovely website. I read somewhere on there that you are incorporating Reiki as well. Is that something you're still doing?
Yeah, I'm trying to do it. I'm still like really learning about ethically what is and isn't going to work, how I want to do that. So I'm still trying to bring those pieces together. But I send Reiki to my patients on my own. I practice those skills. I think I want to do it's energy work, but it's something different that I'm looking for. I'm not sure what it is yet, but I definitely know it has to do with energy. Yeah, we'll see how that develops for me.
How did you come across Reiki?
I came across it through a family member who is a Reiki master, who introduced me to the idea, the concept of it, and, was talking to me about it. I was already kind of like interested in energy work. And so I did do the trainings, but after the trainings, incorporating it in a way, I was kind of stuck, like, okay, how does this make sense? How do I bring these two together in a way that feels right for me. So I'm still working on that. So I'm curious as to what other people are doing and how they're doing it.
I hear this is like a common struggle with therapists and trying to find ways to incorporate these other modalities of healing in a way that's ethical and kind of stays within, not kind of stays, but stays within, what's okay legally. Do you think that there is more of a movement towards trying to incorporate these things? Do you see it with your colleagues? Do you think that we should be separating those two things, or what are your thoughts?
I definitely think, because we have to practice within our scope of practice. We have malpractice insurance that is very real, but we must keep, definitely. And so there's also a lot of education, patient education that's needed as well. And I think also it depends on the population that you're working with. Some of us are in inpatient settings, probably not the most appropriate place to practice Reiki, so it all depends, I think, on a lot of the variables. I think also creating a space within your space, some people need to make that as a separate business, so there's a lot of like logistical things that are really, really important to take your time to research and follow the state mandates and all of that. We're so different from coaching. I think people who do coaching versus clinical work, very different. And so I think that that's also something that a lot of people need to be better educated on. What are the differences? If you're seeing a wellness coach versus a clinician, totally different.
Do you feel like there is any misconception when it comes to what you're doing and also the spiritual aspect?
I think that there could be some misconceptions in terms of some people do not want to do any spiritual work, or do not want to even talk about the spiritual, or are even like connected in that way. And some people have been really harmed by spiritual concerns, not just cults, but within their own church, or, things have happened to people. There's a lot of trauma that people are trying to process. And so they might see a counselor like me who really does spiritually integrated psychotherapy and run the other way. No, I don't even want to go near somebody who does that kind of work. So I think there is a lot of misconceptions about what that kind of work is and how people can benefit.
How do you think people can, educate themselves on what is right for them or what isn't?
I think that if you're really looking to do more of that work related to trauma or experiences from your past that you're still trying to integrate or understand, definitely not the area that you want to do that with a coach. It's definitely an area that you want to see a skilled clinician, somebody who has the training and the education to really help you through a process like that. When you decide to go into therapy, to take your time to find someone that you really connect well with, that you can really feel comfortable with. You might need to see 2 or 3 different people until you find your person, and that's okay. There's nothing personal about that. Us too, we're also vetting you to see like, hey, are we vibing here? Is this gonna like work? Yeah, and it's perfectly okay to do that. And so I think people think like, okay, if I walk into that therapist's office, that's it. I'm stuck there, and no, you have a lot of options and choices, and really give yourself time to explore that.
Yeah, it's very important, like subject to, I think there's a lot of people out there that is actually, it takes a lot for them to actually seek therapy. And once they're doing it and have a bad first experience, they're like, okay, I'm not going to do this again. But I think there's not so much knowledge or talked about that sometimes it takes 5 people to come to the right person. Sometimes it takes 2. It depends on the person you are seeing, what you need yourself, and it is a relationship or like a relation to somebody else.
Yeah, and maybe like one of the most profound relationships that you develop with someone, for sure. Yeah, not to be afraid of that. That's normal. That's part of the process. People think, oh my God, there's something wrong with me that, I'm not finding a therapist. And like, no, you just need a little more time. And every meeting brings you closer to kind of what you're looking for.
Yessenia, do you want to talk about the books you've written? Because I've seen that you have a couple of books, and then you say you're writing a couple more.
I write more in the genre of magical realism, horror. I like that. A lot of my patients are like, what? You write horror stories? I'm like, yes, I love it. So that's always fun. My first book, Santa Muerte, the Daniela story, which I wrote 2015 after an interesting experience that I had, that kind of came to me as almost like a download. I think as I was writing the book, I felt like I had already written the book in a weird way. So it came to me from that perspective, and topics and things that I had never even thought about or, had really connected with, physics and like strange things that I'm like, wow, I've never really had an interest until now about these things. That book came from an experience that I had, almost like a lucid dream, in which in that dream, an angel came to me. And I could see the angel, and the angel was talking to me about fear and letting go of fear and opening myself up in a new way. And after that dream, I woke up and started writing, just immediately started writing. And then I didn't stop writing. It was like every day I was like compelled to write. Prior to that dream, I had been really struggling with my career, sleep, motherhood, battling a lot of different things that unfortunately I couldn't make the decision of like, yeah, okay, I'm done with mental health. I'm out of here, because I had a lot of responsibility to my children and to my family. So I felt very stuck at that time in my life. I had also gone through thyroid cancer, and so I was like really just beat up. So when I had that dream, it really moved me in a new way that I had never even considered writing. And suddenly all of this was like kind of downloading. And then I've learned a lot about publishing and writing, and so continuing to do that. But it came out of nowhere for me.
That's pretty incredible. Do you feel like there was some sense of purpose with the book for you, maybe on a personal level, as well as just putting it out there for people?
I think it was like a first stepping stone to like help me see that I could do it. I had always been a little bit ambivalent about doing my doctorate. I was always afraid of the dissertation and like what the amount of work and research and time, and I didn't have time. I had 2 young kids, and so I was always kind of afraid of that. That felt like a very distant dream, but something that I had always kind of carried with me, had always hoped for. But writing that book, just kicked open those doors for me. That was like, a dissertation was nothing. It was easy. It was something that came very quickly to me.
I'm really curious about the title Santa Muerte, because that means something. A little bit profound in Mexican culture. Do you want to talk about the title?
Yeah, the title kind of just came to me. I like the cultural stories behind Santa Muerte. I really do like that she's kind of like the last resort, the people who feel like they have nowhere else to go but to go to this saint, to this deity, to this culturally kind of being that's been kind of created. This is like the person whom they go to, you know, like the narco traffickers or the people that are like not welcome in a traditional Catholic church, right? And so they need somewhere to go to pray, to ask for help. And so this is who they go to. So I've always worked with the underserved. And so that really connected to me, that resonated to me.
Sorry, people listening are not seeing me nodding. I'm like, oh, okay, that makes a lot of sense. Because if you look up Santa Muerte, if you just like Google it, you'll see all these things that come about the meaning of what, you know, culturally what would you say it is, like a deity, like a being, a magical being, angel, or I mean, there's really no good classification. I think that really defines what this is, but it is a higher power or a being that, like you said, like it's almost like what would you call it? Yeah, people that don't seem to fit in anywhere or aren't welcome go to ask for help. Be a very powerful being.
Yeah. So the gay, the transgender, the drug addicted, the people struggling with HIV, the people who feel very stigmatized in the community, right? Who are hiding kind of in the shadows. You know, this is whom they can pray to. This is whom will hear them. And I think to me, it is still the same spiritual being, right? Like that no matter who you are, no matter what your situation, you can go to this spiritual place. You can connect spiritually in whatever way you need to, but that there's a lot of love there for all of us.
That's wonderful. Do you feel like that you're using your guides or angel or other being like day to day?
Yeah, definitely. I feel very connected to my grandmothers who are always guiding me. I think that they are very close to me and definitely helping me. But I also feel very, very strongly connected to God, to source, to that in itself. You know, through my psychedelic journey that I had a few years ago, in my dissertation, I wrote about the time I spoke to God. And so that was a very direct connection that I feel very close to and that I can really tap into at any time.
Do you feel comfortable sharing about the books that you're writing now?
Yeah, so I'm working on a new book. It's about a Haitian man, a doctor who is part of a exploration of a grave in Cuernavaca, Mexico, that's called La Dama de los Espejos. So he is there exploring this grave, and a lot of weird things happen. Mexico is full of a lot of great stories, great mysticism, and ancient history. So he's there exploring as a Haitian person in a, you know, and so it's about the complexities of some of the migration issues that we're seeing, the awful situation in Haiti, the effects. So it's a combination of things. The other book I'm writing is more of a dystopian story of kind of like what our world in about 50 years. So very different, but very fun to write. And there's a lot of material now, of course, and what we're kind of going through in the United States.
That's so interesting. Do you feel comfortable talking a little bit about psychedelics? How, like, what psychedelics and how was your experience with it?
I'm a very like type A person. So it was something that even my husband was like, what are you doing? What are you even talking about right now? And I was like, yes, I'm doing it. It came about a few months prior. And then when the date came of like, oh my God, today, you know, I have to go and prepare for this journey that I'm going to take. It was very unusual that, like, you know, I'm definitely not the person who you would think would do a psychedelic journey. And it's not something that I ever thought I would do, but it really transformed me. And so I hope that it's something that I can incorporate in therapeutic work in the future as, you know, more and more laws are kind of enacted to be able to do that. I definitely think it's the future in psychotherapy for sure.
Do you think that kind of journey or that kind of trip allows you to see things on a level or experience things on a level that is different from, like, let's say, meditation or getting a reading or doing readings or any of the other tools?
I think it cuts through so many barriers. It really opens you up in a way that very different than I think anything that I've ever experienced. I think that there needs to be a lot of structure in the process in the future going forward, I think people need to be well trained, well educated, and also have a good understanding, because it's a very, very vulnerable position to be in. And you really do need someone who can guide you through a journey in a way that keeps you safe and intact and can process. Because after the journey, the processing is like you're processing that for years. So I think that that's a critical piece, and I'm hoping that that is something that, becomes better established in the field as we move forward with this medicine.
We had a guest on previously who spoke about doing spiritual work, and she believed that she was in a well-established place with well-trained people, professionals, and she went through a journey, a psychedelic, and it did not go well for her, unfortunately. So I think what you're saying is also, it's very important that you have to do, even, and sometimes even with a lot of research, it can, like you're saying, it's very vulnerable. And it's also not just the care during the experience, but after, and then what you do with all that, having the proper support.
Yeah, and I also had a patient who took psychedelic recreationally, and it went very bad. And I know a lot of people who have had those types of experiences, and they're quite traumatized, but they're not really connecting to talk about those experiences to help them move through them, to create new narratives.
Do you want to explain, I guess, for people that are not maybe familiar with magical realism, what is magical realism?
It's a form of literature, it's a form of writing that really explores the ordinary in extraordinary ways. It's definitely, we think of Gabriel Marquez and different authors who have, and it really formed in Latin America. So it's a unique form of a writing style. I love The House of the Spirit and books like that really blend some of the psychic, some of the phenomena in the mundane in new ways. I find that genre very close to home in my own life.
That is so interesting. I never heard anything like it, and the fact that it connected with the culture and the spiritual, it probably has been through generations. Do you want to talk a little bit about that?
I think it's more normal in Latin America. I know, I share stories of communicating with my grandmother who passed before I was born. Talking about stories like that is very normal, I think, in Mexican culture. And it's like, oh yeah, of course, pass the bread, or it's just common. Yeah, of course your grandmother's going to come see you. Why not? But in the American culture and in different cultures, that's kind of like, not something that you want to, have out there, right? So it's very different in terms of the way that things are more normalized. And I hope that that's something that starts to happen more in the American culture, where, yeah, of course you're connecting with your ancestors. Tell me about it. What did they say? What were some of the messages? What did you receive? How are you translating it? Were there symbols? Were there things, where you can explore it in depth and gain a richer understanding? I'm hoping that that's where we're going.
That's wonderful. I can imagine if I went around in Norway here and talked about, oh yeah, sometimes I talk to my dead grandma. People will look at me like, are you insane? Like, it's no kind of place for that to be talked about, being brought up. But I think that can be a lot of people here, they don't really have a faith or believe in anything. They're more atheist and different religions, but it can be looked upon. Some people are spiritual and it's increasing, but sometimes it can be looked upon like spirituality, something that they don't digest that well. But it's wonderful that you guys have the tradition and that you can talk about it and have this openness around it. And I hope that is affecting other cultures and countries and stuff like that.
I hope so too. I know. I think in some parts, Mexico can be a little bit classist, right? So, sometimes when you're talking about spirituality and sometimes it could be seen as like very simple, people who are not well educated or people who are perhaps not as, maybe they have lower reading levels, or like people begin to like think about people in a way that's different, that's othering, but it's ancient. It's been with us all along. I think undervaluing that is to our detriment.
Do you think it's more mainstream now, the magical realism and aspects of it? And I mean, I think I've seen it more like in TV shows even, and like maybe popular shows that I think people watch and enjoy, and they don't realize what they're viewing as magical realism. And I just keep thinking of like Jane the Virgin and the show and the examples that they talk about there, and like just it's a funny show. but you see a lot of the cultural pieces and the magical realism and the generational stuff. And it's a great show for anybody that's like, what is that? What are they talking about? If they want to watch something.
I think slowly it's becoming more mainstream. I think people are very afraid, though, about what it could mean, and I think sometimes some of the shows glorify it in like an evil way or like a bad way or like I don't know, some of those paranormal shows, and so people are left feeling very afraid, but it's not really like that. Some of it is good, but some of it is a disservice as well.
Yes, for sure. Does this kind of is it a good segue into your dissertation? Do you feel like talking about your dissertation or you're like, I've had enough?
Yeah, I mean, I talk about my work as a clinician in my early years. I was working in HIV under the Ryan White grant for many years. Ryan White, I don't know if you're familiar with who he was. So they had left a lot of money for continued research and continued treatment for people with HIV. And so I went into that work, very naive in my early 20s, to work in a very difficult, challenging area with people who were dealing with addiction and different concerns, all interrelated with HIV. So I learned a lot. And most people do not want to work there because these people are dying and there's not a lot of growth there in terms of like, oh, well, you can't really treat them. They're just take their medication and kind of good luck to you. But I found it to be profoundly transformative. I learned so much there. I think that I would have learned in any other setting about hope, resilience, strength, endurance. So I learned so much. So I write about that in my dissertation, and I write about one of my patients who passed away, who I saw later in a dream, whom I communicated with in a dream, and who helped me through that dream. And so it really gave me a lot of hope because I was really suffering when he passed. And his story was he had been shot by police. They had gone into the wrong apartment and shot him 9 times. And as an African-American male with HIV struggling with his recovery, there wasn't a lot back then for him. There weren't parades, there weren't marches, there wasn't justice for him. And so that was really, really difficult for me, just trying to help him. He would be at points where his T cells were like -12. He was like really, really suffering. But he taught me a lot.
That's beautiful and powerful. Do you want to share with people, because you've talked about all these amazing works that you've created, people that want to read your things and want to learn more about you, where should they go?
I have some stuff on my website. I definitely, I have my book is on Amazon under Lucina Stone, Santa Muerte. You can look that up. And yeah, I do publish. So if I do write about just being Mexican, growing up in a Mexican household, and kind of like, my experiences with, my mom as a single mom, as somebody who was not really part of Catholicism, really couldn't be part of Catholicism because she identifies as lesbian. And so being a lesbian in the 70s was a very, very different path than it is now. So I write about those experiences, practicing spirituality at home and kind of what that was like for us, because feeling like outsiders, not really being welcome at that time in a Catholic church. Some of the stories that I share, that I write about.
I can imagine that must be so rough. Everything you've been through and all the wisdom you have is very incredible. And I'm happy you're sharing it with the world.
Oh, thank you. Thank you for that kind acknowledgement. Yeah, there's a lot there, and I think that so many women have stories to share. Going back to like perimenopause, right? Like that may be a great time of reflection, of really gathering your stories, of really bringing them, just acknowledging them, acknowledging that period in your life where you are transforming. So yeah, so definitely, and you can do that in your therapy. You can do that on your own. You can do, begin to do more journaling, more exploration.
Is there anything else you would like to share that we haven't talked about?
So I know people have a lot of different tools that they use. For me, I think in my day-to-day, prayer is a huge component for me. It wasn't before, but after my psychedelic experience, it became a fundamental point, which was very different for me. It's really not a tool that I had really utilized before. Prayer is something that I do before and after I work. I think it's a good time for me. I receive a lot of like information before I meet with a patient. I have that open own kind of channel and write down what I receive. It's not something that I share with the patient, but it's something that I can kind of am starting to confirm for myself, because sometimes when you're developing psychic abilities and psychic gifts, it could be a little bit strange to to share that with. So I'm working on that, and definitely trying to think about, as more and more people are coming into awareness of their own intuition and their own gifts, hope to write more about that and to offer more guidance and mentorship towards those people who are trying to integrate that.
Very cool. Do you want to let people know how to reach you if they're interested? How do they get a hold of you? How do they find you?
On my website, yescounseling.org, they can find me there. All my contact information and stuff to set up an appointment. I love to work with a diverse range of people. I definitely really love working with creatives, people who are kind of trying to express things in ways that sometimes do not align with our standard ways. I really love exploring those types of journeys with people. I definitely integrate spiritually integrated psychotherapy. So if you're somebody who's trying to process trauma or spirituality, and so through that training, how to incorporate that ethically in a way that meets the requirements of the American Counseling Association and all those other accreditations, to do so in a way that is beneficial for the patient. I'm also really interested in mediumship and people who have that gift. I really love helping people with those skills and also developing deeper understandings of psychic gifts.
Thank you so much for your time and everything you shared today. It was a joy and a pleasure having you on.
Oh, thank you so much, ladies. It was so nice to meet both of you and to connect with you guys.
Thank you for listening to Vision Chat. You can find more about us at visionofprofoundhealing.com, where we offer readings, courses, and classes.